but this is going to be a day of golfing and networking with investors and startups, and then one full day of investor summit with various sessions on angel investing, pitching, having some live pitches, actual feedback to the pitching companies, and also hopefully some one-on-one matching of investors and startups. Ultimately, the idea is to be able to get some investable companies and investor groups from across Southern California and also from other North American chapters of TiE together in one room and get some investments going. Other than that, down below is our leadership team. Jerry, I think he's not on the call, but Shankar Ram, who is chair of TiE SoCal Angels. Anshuman Sinha, he's the co-chair. And also our board is on this call. We have Venkat, we have Vijay, Damodar, and Ramesh Patel on the call here as well. As Anshuman said, Anshuman, next slide, please.
Yeah.
We have this event on third Wednesday of each month. And if you know of any companies who are looking to raise money, I highly encourage you to ask them to go to TiESoCalEngines.com and click on start here to create their application. And then they will go through our screening committee and hopefully be invited to one of these pitching events. Our whole investment process is fairly quick. We go through screening, through pitching, and if we like the companies, then we will invite them for a deep dive and due diligence, and hopefully within a few weeks decide if we are going to move ahead with investment. These are our annual platinum sponsors: Commercial Bank, Chub, Beyond Codes, Straddling Law Company, Emirates, of course. Startup Steroid is the platform which powers all of our deal flow, and Century 21. Thank you so much. And I think now we'll get into the first of the pitches, which is ready. So take it away, Dhaval.
So I'm not going to try to pronounce your name, but HDVO. Please open your presentation and share your screen. The format will be that you have 10 minutes to present and then 5 minutes for Q&A. So 15 minutes altogether for your company. If you finish early, we'll use that time for Q&A. But I will try to cut you off around 10 minutes. So try not to go too long. Okay. Having said that, please share your screen and start when you're ready.
All right. Could you make me the host? Or enable screen sharing? Hi, everybody. Okay, it says host disable participant screen sharing.
Yeah, now you can share your screen.
All right.
By the way, pronounce your name first.
HD, just like
HD. Okay, perfect.
High def, Home Depot, you know. So, okay, thank you, everybody. All right, let me go to full screen mode here. Can you see my screen?
Yeah.
Yep.
Yes.
Perfect. Okay, thank you, everybody. Thank you for making the time. Scott Fox, he's on the call right now for introducing me to TiE. And I spoke with Shankar last week, and thank you for the invitation to present. So with that, I'll go ahead. So in Maps, we are building we're building indoor mapping technologies, and we apply it to the facility industry, facility management industry. My name is TiE. I am the founder and CEO. So this is our management team. I myself, 2 engineering degrees from MIT, MBA from Cal Law, and serial entrepreneur with a prior successful startup exit. And my CTO, he's from Caltech. Both of us been in tech for 30 plus years. So we love tech.
And your screen isn't changing.
Oh, it isn't? Huh. I'm not sure why. Can I try it again? Let me stop share and start share again. How about now? Can you see?
Yeah.
Yes.
Yeah, it's good.
The full screen mode is kind of weird. If it doesn't work, I might have to exit the full screen mode. Yeah, so I myself here and our CTO, he's from Caltech. Both of us have been in tech for 30 plus years. So far, our investments are just from family, friends, mostly alumni and classmates from MIT and Cal Law. Scott here is one of our advisors, and Jay Sala here was former CFO of JP Morgan in Asia. This is my dad. He's, are you seeing my screen right now? Is it changing?
No, it's still on the 6 employees slide.
I think it's the full screen mode. How
there we
about
go,
now?
yeah.
Okay.
So just stay on this and you can just change the slides on the left side.
Okay, all right then. This is my dad. He works in Cedars-Sinai Medical in LA. He's in facility management for 35 plus years. And when I graduated from MIT, I didn't think I would go into facility management, but turns out our technology is really great for it and it's a great market. So I've been actually picking his brain about facility management. The job of a facility manager is a critical 24/7 responsibility. They have to maintain the operations of the building, the comfort, the safety. And usually we actually don't notice them. They just keep things running smoothly. We only notice them if the room's too hot and too cold. But it's a very important critical responsibility. And many of the facility managers are still using paper floor plans and spreadsheet, believe it or not. And there are a lot of shortcomings with this. A paper floor plan, you can't search on it. You can't locate equipment easily. You can't share it easily. A spreadsheet will have a list of assets, but there's no information about the location. And lots of times there's multiple spreadsheet versions running around the building, so you don't know which one's the most accurate. And of course, there's no photos on a spreadsheet. So it's kind of difficult to figure out what you're looking at. This is a typical desk of a facility director, and our goal is to simplify his life and put all the information that he needs in the palm of his hand onto an app. And so the process is we take a paper floor plan and spreadsheet of assets, we ingest it and we create a geotag asset database, we incorporate photos into it, and the end result is an app where we show multiple layers of equipment. And so we're the first visual map-based software for facility management, and we replace the floor plans and the spreadsheets. So the key features, when we say map, there are actually many things that qualify as, or rather we should call it in maps. The first thing is interactive. Every element on the map is interactive. You can tap on any icon and get more information about it. Everything is searchable. You can search for a room, you can search for a piece of equipment, you can search for an asset tag. And also every point on the map is geo-accurate. There's a GPS coordinate. And we collect data and then we can integrate this into an API into other software. And the key benefits are save time from locating, save time on the servicing, and then save costs on not taking the wrong parts when you service it or when you replace a piece of equipment because now you have more accurate data. And then also stay more compliant because now, for example, COVID report, they have to provide maintenance report on equipment. We make that process much easier. And lastly, we enable collaboration very easily, both internal and external people working on the site. The market is huge. It's really every commercial building that is larger than 50,000 square feet, that's the size where the number of devices inside the building become too big to manage. And so in the US, there are 88 billion square feet, 5.6 million commercial buildings. Europe, the population is double the US. We don't have the exact number for commercial space. Asia, these are some of the cities where the estimate size. So it's a really large market we're talking about. And this is Stanford Healthcare. This is one of our customers. They're in the Bay Area. They have over 200 buildings, over 3 million square feet. And they've been, when we first approached them, they were using either PDF floor plan or paper floor plan. And so we started digitizing and creating maps for them. And so far they have inventory over 10,000 devices on our map. And here, this is actually one of the examples. You can see alarms, you can see a batch scanner here. So all of these are layers. So each type of device can be filtered into layers. We have existing revenues already. So Stanford Healthcare, over 200 buildings. We've done over 50 for them. We hope to get the rest. Ion Mall is a large Japanese retail group. We've done 6 malls for them. We hope to get all of the rest later eventually. Inchi is a $70 billion French company. They do energy management. And we've done 3 projects with them. They do over 300 in the US. So right now we're in discussion to sign a master service agreement with them for the US. And then ECM is an energy audit company. They do over 350 projects annually, and we've done 3 with them. This is our sales pipeline. So typically we source lead from trade show, we source lead from industry trade association. For example, there's one called IFMA that has over 23,000 facility director and manager membership. We're part of that, and so we were able to source a lot from that. So we take the lead, we invite them to a demo, and typically this is a 15-minute demo, but it always runs an hour because they have tons of questions. And then we offer a 1 month, 30-day trial on one of the buildings, and from there we convert them to signed customers. So these are the consigned customer. I want to highlight a couple of ones. School district here. These are public school district. There are 12,000 school districts in the US. We've signed so far Salinas, which is up in Monterey, and Hayward, which is up in the Bay Area. And then I also want to highlight municipality. There are 22,000 municipality. We're in discussion with the city of Burbank. They have 140 sites right now. And so that's another really attractive market for us. The pricing model is SaaS-based. For each map we built, it's $750. And this would be for a building of 50,000 square feet. Larger building will charge more. And then for user, it's 5 minimum user and $95 per user per month. Later on, we will do IoT devices. This is projected to be in 2023. And then based on these, just the map and the user pricing, we estimate the US market is 660 million to create the map, and then 10 billion annually for user subscription. So this is the pro forma for 5 years. We did about 350 last year, and then we're looking to double or triple that number in 2022, and then eventually scale up to 43 million in 5 years. And this also assumed no additional financing, just organic growth. These are some of our competitors in the indoor mapping space. These 4 have all been acquired. The largest and known one that we know is Locus Lab. They were acquired for 180 mil. And so, the indoor mapping technology is attractive. What we're doing different is we're taking that and we're applying to facility management. In facility management, there are software called CMMS for work ticketing and asset management, but none of them actually have a map. So we're the one who's applying maps, and we want to actually partner with these guys. So we're ready to add jet fuel to accelerate the growth. We're looking for a $1 million price round, and this will be preferred equity at $9 million pre-money valuation. This will fund 2022 operation. 40% will be spent on marketing, 40% on sales, and 20% on R&D. And product development, we also want to add some more features in terms of IoT, in terms of mobile equipment, and machine learning. So lastly, to summarize, we have an experienced team. I was co-founder of a company that exited for $50 million. We have a very large market opportunity. We have a highly differentiated product, and it's a simple pricing model. We validate the product market fit, and our competitors have been acquired. So this is very strong exit potential. So I don't know if I hit the 10-minute mark, but we're ready for Q&A.
Perfect. You ended right at 10-minute mark. So great job. Can you talk a little bit about the onboarding process? First of all, how long does it take from a customer sign up to actually using the system, what the lead times look like, and what the actual process is? Are you scanning maps, or are you feeding data in manually?
Great question. Thank you. Yeah, so this slide shows the onboarding process. So typically the customer will give us the floor plan. Usually these are in PDF or some kind of AutoCAD file. And then they may give a spreadsheet of their assets. We convert this for a 50,000 square feet building. That takes about 4 to 5 days to build a map. And then once we build a map, the customer now has a software app on the iPad or iPhone. And they also have a web portal. And then their staff is actually the one who walks about the building to take photos and mark the location of the equipment. So we're a software company, so we actually don't provide that service. And so the customer themselves do that. And so once you have that asset database, then now you have I'm keep hearing a ping sound. I don't know if that's meant for me. So the customer action, they mark the location of the equipment to get all the photos and the spec data. And then we have a database, and now they can use the app and the portal to look up all the equipment.
So, okay, tell us the lead time and how long this process takes, first of all.
Yeah, so building map is about 1 week, right? And then for them to mark locations of the equipment, that's depending on how many they sign, but that may take them, say, 2 or 3 weeks. And that's an internal process that they do on their own time. Yeah. Okay.
The process by which you're taking the paper map and actually creating the digital version, is that automated or is that a manual process?
Yeah, so we have software tools to build that. Currently, half of it's automated, and we're working to automate the rest.
That's a proprietary tool?
Yes, we built from scratch. It's proprietary.
Okay. Yeah. Sorry, go ahead.
Oh, no, I was just going to say it's proprietary tool we built from scratch.
Okay. So have you gotten any pushback on this process, or what are some of the reasons why customers are not converting?
Yeah, actually the pushback is from IT, not so much from facility. What we've learned is facility guys, when they request IT to help them, they're low on the priority list. And so they actually, IT just so busy. I mean, we all work in IT, we know. And so usually their requests being kind of low on the priority list. And so it's actually easier for them to go to an outside vendor to get things done. And so, and the other pushback from IT is security. They want to make sure they audit the software properly and so on. But as far as the facility team themselves, they love this. It's a cloud-based software. They just, all you have to do is go get us the floor plan, and then we build the map and they're good to go. Recently, we just had a case, actually just this week. This facility director really loved our software. He needs to start inventory his building. IT said, well, you got to go through security audit for 3 months. Somehow he did it somehow, but he got it approved within a week. And then now he's using our software. Yeah. So.
Okay. So how many customers have actually gone through this process, let's say in the last 6 months?
Yeah. So, going back to this slide here, these are the existing customer already. And then these are the ones that we're doing trial deployments, and in another month or two, we'll hopefully convert them as well. And then also we have more leads that we're filling the pipeline. So.
Okay, let's talk about competition for a second. You had a list of companies that have been acquired. What has happened to them? Any updates on where they are today?
Yeah, I'll talk a little bit color on these guys. Marcello was acquired by HERE, which is the consortium of BMW, Audi, and Mercedes. And so it's private, so I don't know too much about them. But Marcello was making indoor map before they were acquired. JiveStream was the same. The ones that I was able to get a lot of information on is Locust Lab. They built airport maps. And if you use like the United Airlines or American Airlines, you will see maps inside. Those were actually built by Locust Lab. What's interesting was they were acquired by Acuity brand, which make lighting. And they were making smart lights. So these lights now, I think, can sense how many people are inside a room. So then the question is, why does a lighting manufacturer acquire an indoor mapping company? And my guess is that they're combining IoT with indoor map. And then that's the only reason I can think why would you want a lighting company would want to acquire indoor mapping. Yeah, so this was public, whereas the other acquisition was private.
Okay. We have a bunch of other questions for you, but we're already at 15-minute mark, so I'm going to have to cut it short. Just one yes or no question before I let you go. Stanford, is it a customer or is it a hot lead?
It's a customer. It's
okay.
It's a customer.
Perfect. Thank you so much. And we'll reach out to you in the next 24 hours or so with additional questions and also guidance on where we're going to go next.
Thank you. Okay. Thank you. So should I
log off? Thank you so much.
Should I log
off? Yes, please.
Okay. All right.
Thank you for coming today, though.
Yeah. Thank you, everybody.
Okay. I think we're still waiting on the next presenter to join.
Pankaj Singhal.
Is Pankaj in? I didn't see him come into the room, so Yeah, I don't think he's here yet. So we can discuss the company. Scott, I know you're sort of, you have inside knowledge on this. Any thoughts you'd like to share?
Sure. I met HD several years ago. Those of you who know me know I run monthly masterminds groups for startup founders here in Orange County, and he was an early attendee, and I liked him. He had a good background. He didn't know what he was doing next, but over the couple years, they developed that. I became an advisor. I'm actually an investor in the company now, so I'm completely biased. I think it's great. I think the upside here, I mean, if you think about what Google Maps did for the external world, this company has a potential to be a big player in the indoor space. And especially if you think as far ahead, obviously there's day-to-day needs for commercial buildings and management, which is a totally legitimate, huge business. But if you really want to expand, you think about augmented reality and the metaverse, and if these guys have a really good global database of indoor spaces, there's just all kinds of different things you can do with the data and the potential.
Hey, Scott, one quick question. This is Vijay. Do they integrate, do that system integrates with GIS?
I'm sorry, was that directed at me?
Yeah, does that system integrate with the GIS maps and things like that?
I don't know about that, but it is GPS enabled. He underplayed that. It's all very, these maps are really three-dimensional. I've been working with him to improve the deck actually, so that you get a sense of how interactive they are. So I maybe, but they're way beyond any other map that I've seen.
Vijay, no, they're not integrating GIS. No.
Thank you, Shankar.
GIS is much more outside external. This is more internal. Plus, it's a location facilities management, right? Most like mapping and facilities management rather than geographic information.
Shankar, I know you spoke to him last week also. Any thoughts you'd want to share with the group?
Okay, to be frank, HD and I got along very well because this is where my first job in this country was. I did automated mapping and facilities management. I wrote the graphics on the database. I said, after 40 years, I'm coming back. You guys are doing it on a tablet and iPhone. I did it on a digital equipment wax machines. So I know this business in and out. I already invested in 3 companies in indoor mapping, including our Track Point, which is sort of indoor mapping for hospitals. So I know this industry in and out. So it is a good position to be in. It's how fast he gets customers. He's only doing fixed, assets right now. The moment he goes to movable assets and other things, there's so much scope. There are a lot more companies in indoor mapping, hospitals, airports. There's a lot of companies. As I said, I have invested in 2 other companies. There's a lot of companies competing. But to add I call it database, the data along with it, that's why it's called automated mapping and facilities management. So do that. There's not that many companies doing that. So it's a good space. It's a good space. I know the space. I love the space. I wrote programs in the space. So
I see some questions in the chat room a lot about why don't they buy, and the issue, that's obviously always a good question, but the issue for him has not been they're not buying. It's that he doesn't have the resources yet to address everybody that's interested. They have a very pregnant pipeline, and the people that do this, facilities management, is generally underappreciated, but and one of your other questions is the pricing. One of the reasons the prices are low is so that it can slip into an operating budget rather than a CapEx budget. And these guys, he's targeting sort of mid-level managers rather than senior people, and they can just crank it out and sign up themselves online. And the vision for this is that it's self-serve online so that it can, especially if they get the mapping, which is a great question, right? How do you get the maps? But once the maps become even faster, automated, the whole thing can just scale globally on its own. That's really the vision.
And the other
what is unique about them? What are they doing that's so special that like an Accenture or someone just can't pick up and just do that?
Shankar, you have a stronger background than I do. I could talk, but you probably have a...
The other thing is, sometimes the people, they don't see an immediate ROI because they already have these in spreadsheets. They already have the data. So especially on fixed equipment right now, if you have something fixed and you know where it is, it's in a spreadsheet, you don't get an immediate ROI. And so people take time to decide to buy it. What they're doing unique is now, especially in a bigger facility, like a big hospital, medical centers, huge facilities like, a government facility, there's so many assets distributed everywhere. And the accountant just put in the balance sheet, that's all, they don't care. And there might be a big maintenance department taking care of all that. but they don't know exactly, there are a lot more data he can add to it. For example, this generator sitting there, when is the maintenance due? When is that due? That's what the maintenance management companies do. So this adds a dimension, multiple dimension, like I said, the graphical picture of it, photographs, position. So when you have a huge facility, it makes a lot of sense to keep track of what everything is. When I did this, I used to do outside, like valves and oil industries and chemical industries, where they used to know where is this valve, when does a valve need replacement, how old is a valve. That kind of data can be collected. That is a non-graphical data. The graphical data is the location, the GPS positioning. So they brought this mainly to inside the building now. It is outside, now they're doing inside, but it doesn't take long for him to do outside also. Theoretically, without the map, he can do it too, but inside the building. And GIS systems like ESRI does that too, but ESRI does outside the buildings. They only look at the geography, whereas he's looking at facilities, buildings, hospital centers, medical centers. It's not that many people do it because the ROI is sometimes difficult to prove immediately. They say, oh, I already have it, it's all there. Why would I worry about a generator sitting there? So it's a little bit tricky, but once you're in, once you start using automation, everything is being automated, then they'll get a hang of the whole thing.
Guys, we have our next company here, so we can continue the conversation a little bit later. With that, Pankaj, welcome to the pitch event that we have today. You're already sharing your screen, so that's perfect. We have 15 minutes allocated for you, 10 minutes to present, 5 minutes for Q&A. If you finish your presentation a little bit sooner, we'll use that time for question and answer. But I will have to try to cut you off at 10-minute mark so we can get some questions in. With that, start when you're ready.
All right, thank you so much, everyone. Thanks for having me. Yeah, I'll be talking about Gattaco, a company that's trying to move lab quality clinical tests, existing tests, but more to an at-home or a point of care or a point of need setting. I've been involved with the company for a few months, and just a little bit about the team. I've been in diagnostic myself for quite a bit of time, had a few decent exits, I would say. My last company was acquired in the blood collection space, but more in the liquid biopsy cancer space by Exact Sciences, which is one of the largest at-home success stories, but more with a stool sample, as well as a couple of founders that are mentioned here are part of the team. A couple of people I wanted to mention, I brought in some board members and advisors who are really industry experienced. And I noticed maybe on your website that Murli Prahlad, who's a good friend of mine, his family's been involved with TiE for quite a bit of time. So just wanted to mention that. And these are people who have been in life sciences and diagnostic space for quite some time, helping do deals and taking companies basically to the next level, so to speak. So trying to build a good team and knowledge base around this market opportunity. And really in terms of trending, I don't have to say we are all familiar because of COVID with at-home testing. But the point I'd like to make on this slide is people are getting more and more comfortable. Of course, telemedicine is here to stay and growing really fast. But the swab and the saliva tests we're doing at home are really very limited to a few applications. 70% of all diagnostic testing is still based on blood. And if we can do something about bringing that blood testing to a home environment or just anywhere environment, that would be a great driver for telemedicine, for testing. But that's only possible. Most of those tests are only possible in a lab today because of the complexity. And really the complexity there, why blood testing is done in labs for 50 plus years now, is that the cells start bursting as soon as they come out of the arm with a phenomenon called hemolysis, the bursting of red blood cells. And really a blood sample, which has hemolyzed blood cells, looks like this red supernatant on top, whereas ideally the sample you want from blood is the yellow plasma, which after centrifugation, you can see if you spin down the blood tube immediately. That's what's been happening for 50 plus years, but requires a lab to centrifuge, to have the lab set up and the operators who can then pipette out things correctly. Otherwise, you lead to a lot of rejected samples. And of course, in quantitative testing, a lot of misdiagnosis, which is why this is all done in a lab. And so there are some technologies that are trying to move blood testing to home, but really all of them are dealing with blood. And plasma separation, if it's not done immediately, can still lead to the issues I talk about. I won't go into detail of all these technologies, but dried blood spots, some liquid arm patch devices, they're starting to appear in the market. Even mobile phlebotomy, we all hear about, you can schedule and have somebody can come to your home. But that's really not scalable solution at a lower cost. And so what Gattaco, again, I've been in this space for a long time, is probably the first and only plasma collection device that can be done at home to deliver the clinical sample as well as at-home access. So it can be dropped easily into an existing lab-based test to get the same results a test could give. And on the right is just an image shown of the product, but really this slide kind of clarifies that you take a finger stick sample, for example. Again, we're not limited to that, but without any equipment, you can have passive elution of plasma based on the size or charge of the biomarker, and that accurate liquid plasma is available. And here's a video I can play in parallel. Hopefully you guys can see it. It's as passive as just touching your finger to the device, and the blood basically just wicks in, and then the magic happens, so to speak, in terms of plasma getting separated. And the IP that Gattaco has, again, published patents, that separates out. So a user basically presses a button to dispense that liquid plasma, and then it can be collected and shipped to a home, or it could be used for lateral flow tests or in future integrated tests for blood done from home. And that's what we show here is compared to other technologies here, the current product, the first generation product, we would collect the plasma at home and mail it in regular mail, just like we're mailing saliva samples or swabs sometimes to a central lab and test it. And in future, we're working, of course, with a collaboration on doing that entire test at home. And it avoids all the complexities of the other processes that I've shown here in red, where every one of them requires lab setup and they can never move testing to home. This slide just shows how we're differentiated in different parameters in terms of quality of sample, workflow, again, all because it's a clinically relevant sample of plasma that's delivered accurately for the downstream test. And ultimately, this is a scalable solution, we think, because mobile phlebotomy is never going to be cost effective. Maybe we can do them in major centers, but it really comes at a high cost, as well as other devices which will never catch up to a passive elution kind of methodology. So that was kind of the background of the technology. In terms of markets, where we're going is really the at-home plasma collection, as well as at-home collection and testing. We're starting out with COVID antibodies just as an example, just because protein biomarkers are easy to show effectiveness of the technology. But overall, the field of serology testing is open to us, as well as the other mentioned on nucleic acid, like infectious disease or chronic disease like rheumatoid arthritis, where patients have a hard time going to a doctor's office or a lab to get blood drawn frequently. So we're looking at monitoring time applications, which are large volume, but only possible in a lab. But all existing tests that we can really displace from a lab draw to a at-home draw kind of scenario. Here's just an example of patients, just to show some proof of concept that we followed 2 people who got the Pfizer and the Moderna antibodies or vaccines. Day 0, we're comparing our device, which is the APON device, our first point of need, so-called device, against a venipuncture blood draw, and just showing that we can track pretty close to what a venipuncture can do. And we're using an FDA EUA cleared test, basically a neutralizing antibody test from a company called GenScript to show that example. There's, again, a lot more data behind this, but not enough time to cover, of course, in this. So a little history on the business side, just pivoting to that. Company was incorporated in 2018, developed the first kind of APON prototype device, as well as patents being issued. A lot has happened, of course, in the last year. And again, part of it, I started getting involved with the company with my background, I would say about mid-2021, or maybe Q3 almost. We have done a partnership with a flagship COVID-19 antibody test company, as well as a full sample to answer platform development company. APON was part of the SpaceX launch for zero gravity sample collection, because there are crew members who needed to do some testing and how do you draw blood in space. We've added our team, we have completed feasibility, and most recently, actually just recently, this beginning of this year, we have signed a pretty significant LOI for a global supply and distribution agreement, again, in the research use kind of application, because we're still validating the in vitro diagnostic. So what we're looking for right now is to scale up our manufacturing and commercialization, as well as advance the pipeline. And assuming, of course, we capitalize the company appropriately, here's just an example pro forma kind of P&L projection. We plan to generate some revenue this year, probably towards Q3 and Q4. and then of course scale from there. And I know we've all seen all these charts, so I don't put too much credence into the ramp, other than I think the potential is there because the market is almost 2 to 4 billion for even a sample collection play. But of course, we need a lot of work to develop the products as well as commercialization. So what we have laid out are a few milestones. On the left are just showing the milestones I mentioned. We did raise $1 million out of our $1.5 million round. Techos Angels was one of the parties that's involved. So some of the people I think overlap. I won't go into these again, but we're working on both the R&D, the manufacturing. We built a room, quality systems. So our plan for this year is to really complete that IBD development, advance our pipeline, get the right certifications on the quality system so that we can launch the RUO and the CE mark product globally. And again, now we have a partner who is our test partner, so they can bundle our product with theirs. So we feel there's some good traction possibility with that supply and distribution agreement. And then of course, going forward, we plan to then convert that RUO and CE into FDA IBD mark products and continue from there. So in terms of the ask, as I mentioned, we started out with $1 million round, and I can give some background later if we have time, but we actually were getting oversubscribed. So we expanded the round to 1.5 million. We turned down that deal because it was giving us more money at the valuation that we were not ready for. Whether that's the right call or not, we will see. But we are offering to have another 500K raised at the same valuation that we completed the round in December, just because now that we have the LOI, we really need to invest into scaling up pretty fast. So, and we're offering a 25% discount on preferred for Series A. With that, I hope I've covered enough ground. Happy to answer questions. This is kind of a summary. We're in the right industry at the right time, hopefully. A unique technology, a team that's building. I do have some people from my previous companies in ops and quality and other areas that are helping us contractors even today. We have very good IP protection, and it's been looked at by some law firms who are willing to defer a lot of their fees to really help us raise a Series A, which is what we're going after this round, basically, is a Series A raise. And I'd be happy to answer any questions.
Perfect. So first question, and by the way, all of the investors, feel free to put the question into the chat box. Any backlash from investors on Theranos?
Any what?
Backlash from investors on the Theranos deal and what happened there.
Yeah, it always comes up, as you can imagine, Deval. And I guess my answer is yes, there's always going to be that skepticism. Hey, is this real or not? So I'm actually glad that you bring it up because it shows the market opportunity was always there. But we have a device that works. We already have a partner that likes the data that we've generated with their antibody test, as I mentioned, and that test is FDA EUA cleared. So in that sense, the credibility is there. The team hopefully knows what it takes to build a diagnostic product rather than trying to build a CLIA lab and you know, talk about fraud, so to speak. So
I think, yeah, enough said. So let's talk about the LOI. What is, can you give us some details on the value of that proposal and any other color on the agreement?
Yeah, I want to say very openly that it's a supply and distribution agreement. So it's partnered with the company that we're, the test company, GenScript. They are a multinational company, which is already selling about 100,000 tests per month for their tests. Now, ideally, we're not going to get to 100% adoption, obviously, but they want to bundle this device because they can expand their market as well as bring a new kind of segment of the market into play. They already have a distribution network settled globally. I think they have about 40% market share in North America, 40% APAC, and 20% Europe. So they want to bring this in. In terms of value of the deal, I think we still have to deliver a product that can scale, not just work, but scale. And we all know that takes work and capital. So there's some risk there, of course, but they are willing to commit in this LOI that they would start off with somewhere between 10,000 or so our devices per month. And at about a $20 price point after their discount, that's a significant amount of sales that we can generate. So the potential is there, but there's a lot of work to be done to get there. And so we plan to sign a definitive agreement based on this. Actually, it's a term sheet, not just an LOI. So we've agreed on key terms. We would probably sign a definitive agreement based on this, hopefully in the next 30 to 45 days, worst case.
Got it.
But they're not making an investment today based on this. So I want to be upfront about that. We did try. We wanted to have their investment in. They would make an investment in terms of manufacturing capacity. So that they have agreed that if we need capacity to scale, they have plenty of lab and production capacity, that's how they would like to partner.
Okay. We only have about a minute and a half, so I'll try to go quick. How long will this money last you, 1.5 million? And what are the key milestones you hope to achieve in that? And then also any viewpoint on exit.
Yeah, so to be very candid, we raised the money starting Q3 and Q4. So we've been using that million. And so this 500,000 would be, and our burn is going up. So it's hard to project as we're trying to scale up. So we also are starting in parallel with VCs. And now that we have this LOI in terms of attracting institutional investors, I would say this remaining 500K plus what we have in the bank would carry us probably for 4 to 6 months. Not too much more than that, but I think that gives us enough runway to really go after institutional investors for a Series A. So maybe the answer is 6 months conservatively. We could stretch it there.
By summer, you'll be fundraising an institutional round.
I have started now.
Okay. And any thoughts on exit?
Well, so in terms of exit, I think it all depends. Again, I've had 3 exits, so I can say, yeah, sure. Companies like GenScript could be a potential M&A target. They do M&A. They don't do strategic investments. But if we become a big part, a big customer, that kind of company, as well as any CLIA lab that wants to add on, could be a potential exit partner. Last company that I exited, we were acquired by my largest customer. So that's one angle to go after. But of course, we could be part of a tools company's war chest as well. In terms of valuation and all that, I think it all depends on what stage we get.
Let me clarify. We're already out of time, but when do you think you'll reach the scale where someone like this can acquire you and consider you a viable acquisition target?
Oh, I would say we would be a bit positive by 2024 in this scenario, right? Okay. So if I look at that, we're generating revenue, we're a bit positive. We're a prime candidate even before that.
Okay, perfect. Thank you so much. As far as next steps, in the next 24 hours or so, you'll get an email from us. We have a bunch of other questions in the chat, so we might give you some more questions to answer, and then we'll also give you some clarification on next steps. But thank you so much for coming in today. Really appreciate your time and your presentation.
Thank you so much for having me. Appreciate it. Have a good night.
All right. Good night. Okay, we have the third company. Is Amir the right person, Anshuma?
Yeah, Amir is in the waiting room, but Shankar, do you want to talk about this company or we should let in Amir to come in?
Amir, we can talk towards the end, yeah.
Okay.
All right. So let's admit Amir. Amir, can you hear us?
Hi, Ansuman. Yes, I can hear you.
Hey, Amir. This is Dhaval Kapadia. Welcome to the TiE SoCal Angel Group. Today, please open the presentation so you're ready to share your screen. But as far as format goes, we have 15 minutes allocated for you, 10 minutes for a presentation, 5 minutes for Q&A. If you finish your presentation early, that's good because we'll just use the time for Q&A. We generally have a lot of questions. But at 10 minutes, I will have to cut you off. So just fair warning. With that, feel free to share your screen and start when you're ready.
Sure, done. I'll just start in a second. Dhaval, you can confirm you can see my screen now?
Yes, I can.
Okay, great. Okay, great. Shall I start?
Yep. Go for it.
Yeah, great. Great. I guess good evening to all of you. It's good morning here in Bangalore. It's about 7:30. So I'm Amir Walani, founder and CEO of Adipiter. Our mission is to become market leader in terms of back and neck pain prevention. I started this in 2017, unfortunately, because I lost my dad to back pain related complication. And since then, my mission has become to actually focus on building a platform to kind of prevent and control existing back and neck pain. I guess the MSD market is huge. It's about $80 billion market currently. Posture ergonomics and injury prevention is a big thing especially for the Western market, be it US or the Europe. In India, also pretty much you can see that recently we are seeing a lot of prominent media talks about how the back and neck pain are becoming prevalent in the IT workers and others. What we have developed is a smart wearable device that tracks your posture, corrects your posture. It basically does 360-degree posture care. It does posture correction, tracking, training, and management. So it has a built-in AI-based training, AI deep tech-based training to improve your core muscles and the posture in about as little as 30 days. Now, these devices primarily built for the working professional or the people who are sitting more than 6 hours, or of course, if they are working while using a standing desk. Primarily for the people who have the posture problem or who have a back or neck pain. Since it is also in the prevention game, those who are preventing the workplace injury from the IT workers or the corporate workers, this is ideal for them. It works on biofeedback therapy and behavioral science therapy. Essentially, it's a habit-changing device. Now, our mission is to become a full-scale MSK care provider. We want to achieve that using the ecosystem of product and services. What we have so far built is a central piece that you can see here, which is for back training, tracking, and monitoring. What we have started working is building the corporate subscription module for the corporate ergonomics and the posture related piece. We are also in the process of building the user gamification module along with that. Down the road, we'll be bringing the health. Down the road, we'll be bringing the health expert, be it physical therapist or orthopedics on the platform. We also want to bring some of the premium content from the expert, to kind of focusing on the similar areas. Currently, from the architecture side, what we have is the stack device and along with the mobile app that tracks your posture. We also have all the data is currently stored in AWS platform. We have a mobile app available for both platform, Apple, the iStore and the Android platform. Now, these are some of the data that we collect from the sensors. Along with that, we also collect some of the data from the users, which includes your height, weight, your BMI, in the sense your age, gender, and those kind of stuff. We combine that with some of the data that we get it from the sensor, and then we kind of use a deep tech algorithm to improve your posture, also for the bad posture detections. This is just a snapshot of customer journey. So when the user uses first day, he will be able to use in the training mode. So he will be able to see his current sitting habits. Within a period of maybe 2 to 4 weeks, he will be able to see how he has improved his posture. Because let's say when he is using the device first day, he will be able to see how many times he's slouching per hour, how much time he's sitting straight, or his inactivity. Versus after 2 weeks of using device, he will be able to see that his slouch count is decreasing, his straight posture time is increasing. So there are beautiful graphs available on the mobile app that they can monitor their posture improvement progress. On the competitive landscape, currently the upright pause that was recently bought by Dario Health is our major competitor. In a way, they are the only one competitors we have in the US market. They started with fairly successful Kickstarter. They also got Series A funding. They were acquired by Dario Health, which is into chronic health management, because now they want to take that to the B2B customers. There's another competition we had was Vigilant Technologies. They were also recently bought by Sword Health. Unfortunately, amount is not disclosed. And in the Europe, we found there's one more player called 8sense. They pretty much started at the same time we started. We already commercialized our device a couple of years back. They have just released their device. I would say about 4 months back, yeah, last year. On the go-to-market strategy, so far our focus has been mainly on Amazon and other e-commerce platform. This was primarily because of the last couple of years, it was hard for us to get into physical space, physical marketing. Of course, we absolutely want to bank on the physical therapist and the orthopedic channel, in next few months, once we have a funding in place. We want to also explore corporate wellness, employee benefits related platform. Of course, if we certainly need to crack a deal with the payers or insurance to get into that channel. This is just a quick milestone of where we are. We spent about almost close to 2.5 years in building, making the products, and testing the product with the patients. Then we launched in 2019, second part in the Amazon India. Last year, we also did some test marketing for the US market. Currently, our revenue is about $8,000. Of course, last 3 months has been difficult because unfortunately, all of our team members got COVID one by one, and marriage also in the team members. So, but I guess we should be now back on track because the third wave is going almost in India. On the certification side, we already got all the 3 FCC, BIS for the US, Europe, and the India market. On the clinical trial, we already started discussion with University of San Francisco Orthopedic Department. So that should, the modalities we are kind of almost finalized. We are just finalizing in terms of the time frame and those kind of stuff. On the team profile, I am Indore alumni. I have also done my master's from SMU, Texas. Did couple of successful startup. First one I exited to Easy Mobile. It was mainly building the value-added services for mobile operators. Second was more of a performance-based marketing. The 2 other co-founder that I have that comes from a complementary skill set. One leads the hardware design and R&D part. The second one leads engineering. He takes care of the firmware and the mobile app development. On the advisor, we have a 2 advisor that comes from the subject matter expertise. We have Dr. Sachin, who is a senior ergonomist, delivered more than 1,200 ergonomics talks to corporates. Dr. Dhananjay, he is a practicing physical therapist. He has a chain of about 12 clinics in Bangalore. The 2 other advisors, one come from strategic thinking, leadership background, and the other comes from technical know-how. He is currently CTO at Trello, which is funded by Sequoia. On the traction side, this is a quick snapshot of last 3 years. The first year we had revenue of about 27K. Second year, 24K. The third year, which is currently, is about 60K. In the second year, unfortunately from last 2 years, the lockdown we suffered. But this year we were able to do decent, and we also did some test marketing in the US market. Since we are purely playing into the prevention game to start with, its market is huge in the USA versus India, because in India it's a hard sell for prevention, whereas in USA there's a lot of awareness and people are ready to spend money for that. This is kind of 3 years projection that we have. So currently we are charging one time for this track, but as I mentioned before, we want to introduce the subscription model in next 6 months. We will be also building the ecosystem, so we'll be adding the revenue from the ecosystem as well, also the data that we have been generating from the sensors. So the revenue models will be the one-time charge plus subscription plus the ecosystem revenue and the data related revenue down the road. We are looking about $500,000 at a $3 million valuation. I have just given the breakup of where we are planning to spend this money. It's mainly for the manufacturing, branding, marketing, and the building the corporate subscription platform. This is a quick snapshot of 3 years roadmap. We will be building a lot of IPs in next 3 years related to ecosystem. And this this roadmap is aligning what I have mentioned in my previous mission. That's how I have bucketed it. On the IPR side, we have already secured trademark in India. We have filed for USA. We are also kind of finalizing the patent for filing in India for the AI deep tech algorithm that we have developed. We will be definitely filing the design patent once we have funding in place.
Okay, so I'm gonna have to stop you there. We've
That's the
reached
last
10
slide,
minutes.
Dhawan. Sure.
I'm sorry?
This is the last slide, but precisely
Okay.
right time.
Perfect. So keep it on the screen. The first question is the actual device. Can you tell us about how you wear it, how it detects when you're slouching, when you're standing slouching or sitting slouching?
I apologize. I'll just get the device. So the device is very small. Just give me 1 second.
Okay.
So that's the device that you see here.
Mm-hmm.
It's a very tiny device that goes on your back. The way you put it is the device, you put it inside your shirt and you put magnets from top. That's it.
Okay.
Were you able to see that, Dhawan?
Yep. So you're actually not connecting it to your body, you're connecting it to your piece of clothing with a magnet.
So we have both options available. One is adhesive option where you can just stick adhesive here and then you put it on your back. And the second option is we have a magnet where you can put it on piece of cloth. The advantage with magnet is you can use it unlimited time. You don't have to repurchase the adhesive every month,
Right. So the technology behind it, how it detects the slouching.
Great. So actually, we have used kind of age-old calibration technology, which is calibration method, which is used by most physical therapists. When you start using the mobile app, it will help you kind of understand how do you sit straight, and it allows you to calibrate it. So calibration is a reference point for us. Our algorithm takes that as an initial data point, and then from that it will start learning. And whenever you are slouching with 10 degree, 15, 10, 20 degree, depending on cervical or other slouch, we detect that and we kind of alert you.
Is that the same way upright works?
Almost pretty much, but we have some differences in terms of the algorithm that we have developed using the AI deep tech sense.
Okay, let's talk about pricing. You said it was about $65 or 5,000 rupees. The Amazon page you had on screenshot, you had I think different price. Can you talk about the price, how it compares to upright, and the monthly subscription cost also?
Sure. So the in India, I mean, on Amazon it'll be always 5 to 10% on and off year discount because of the sale and other things. But the pricing is almost similar. It's a $63 something right now. Now, subscription platform is what we started developing. So we are planning to introduce that in next 2 quarters. That will be primarily bringing the ergonomics and posture related content. Because one of the major things that we want to focus is activity during the office hours. Right now, most of us keep sitting hours without moving, So we want to make sure that we combine that with the ergonomics and we help you kind of improve your posture. So right now we are thinking we'll be able to charge between $4 to $8 per month. But we need to yet finalize how much we'll be charging down the road,
Okay. And does the pricing for both the device and the monthly match upright competition?
So right now we are, of course, as I said, right now we are not charging any subscription. Mobile app is completely free. But once we have enough content, then we want to charge it. Now, Upright Pause, they have they bought by Dario Health. So they have a now chronic health platform. So they bundle the fees along with their diabetes management, the weight control management and all that. But I believe it is roughly about $8 to $9 per month is what my assumption is coming.
Okay. Where are you manufacturing these, by the way?
So this is currently in Bangalore, designed, developed and manufactured by us here. The only assembly part we have outsourced to our assembly partner Avalon, but everything is controlled by us, managed by us.
Okay. What does the exit strategy look like for you?
So we are, we can be a good target for companies like Hinge Health or Commodos or Lovingos and others, because these guys are purely playing into the control aspect. So they are into rehabilitation management. They don't have currently prevention. And that's where we bring in. That's why Dario Health bought Upright Pause, because these all guys are into chronic back pain, neck pain management, but they don't have prevention angle. And so far our focus has been prevention big time. So that can be a one exit. Of course, the other exit can be, since we want to focus on the full scale MSK providers, we can be bought by wearable devices like Fitbit, Garmin, and those. There are multiple exit scenarios which I have put down.
Okay. We're already out of time, but I just want to ask you one other question real quick. How's Amazon going? What's your cost of acquiring that customer? And we see that there are about 6 reviews last year, a couple of reviews this year. Is the sales going up, or how's that channel working?
So Amazon was doing fantastic. As I said, we generated about 50K revenue in 6 months after we did the test marketing in the USA. Last 3 months has been difficult on quite a couple of fronts. One is that we have run out of inventory, unfortunately, and there's a huge shortage of silicon wafers in China, Taiwan market. So we are working with this guy Avalon and our other Aero partners to kind of produce the next lot of piece for us very quickly. But Amazon has been doing great. In fact, Upright Post does about 3,800 to 4,000 devices per month, because we do talk with Amazon and then they do share with us the numbers. So I mean, if we spend enough money in terms of awareness, we can see the huge market in the US especially.
Okay, perfect. Thank you so much for coming on today. Really appreciate your time. As for next steps, over the next 24 hours or so, you'll get an email from us. It might be more questions because I know our chat is going, so we might ask you a bunch of other questions, and we'll also give you some details on next steps. But appreciate your time. Thank you for the presentation.
Thanks, Aval. Thank you so much. Thanks to all of you.
Bye.
Bye.
Guys, I don't know if everybody saw, Zena has this device and has been testing it. So we can certainly ask her some more questions near the end of our call. But with that, Anshuman, we have one more company, Wave Technology.
Yeah, I have reached out to him to see if he can join us early.
Okay.
Yeah, here he comes.
There you go. Okay, perfect. Good timing.
Yeah.
Hi there, Sebastian.
Yes, hello.
Can you hear me okay?
I can.
Perfect. So please open the presentation, get ready to present. I'll just give you some ground rules in the meantime. We have 15 minutes allocated for you.
Sure.
10 minutes for presentation, 5 minutes for Q&A. If you do finish the presentation beforehand, no worries. We have tons of questions, so we'll just use that time for Q&A. But if you run long, I will have to cut you off at 10 minutes. Okay? With that, please feel free to share your screen and start when you're ready.
Sure, not a problem. Can you guys see the screen okay?
Yes, we can.
Perfect. Okay, so and for the sake of 15 minutes, I will go through this fairly quickly. If you guys have questions, please feel free after we run through this. But the long and short of it, Wave is named after the most proper file that you could send within the music industry that carries the most amount of data. The Wave file. Wave is been considered the Uber of the music industry. It is a live, geo-targeted service hailing app for music and audio pros. The opportunity is really fairly simple, and it became more clear during the pandemic. However, amongst me and my business partners, we've always known this within the music industry, that there is no current opportunity or solution within the current music industry or marketplace to solve immediate needs of recording studios, producers, and or artists to efficiently and cost effectively create albums without having to rely on a small network. right? So we have things like Craigslist, like SoundBetter, like Jamcard within the music industry, which help you recruit the right talent. However, it's long. The process can be expensive. In many cases, some of these apps charge quite a heavy percentage to get your name out there. So our app addresses pretty much every single void, whether it's for service providers or for professional studios. This is our CEO, Mike Zombie. Mike Zombie is a producer who produced Drake's Started from the Bottom. Drake is a very popular rap artist here in the United States. And Mike puts it really simply. As a producer, Mike runs into this problem very often where people are asking him, do you know a producer? Do you know a lyricist? Do you know a composer? And it actually takes up a lot of his time giving out referrals rather than focusing on his own music. So Wave connects artists and producers to music pros geographically and in real time. So they immediately address any production needs. We do this very simply, focusing on 3 core elements: disruption, decentralization, and democratization. We do this by the way that we attack how we address our users, how we make it simple for our users to connect with each other, and the efficiency at which they can do that, how they're broken down and categorized within the app. Wave is revolutionizing and revitalizing the music industry. We are creating opportunities and creating economy. We are saving money for producers and artists, and we are helping studios make more money. Our current total accessible market right now is 1 million jobs within the United States alone, with 7% year-on-year growth. In 2021, through the pandemic, at any given time, there was 72,000 working professionals in Los Angeles within the music industry or audio industry looking for work. This is a gig economy that we're talking about. So we're going to compare ourselves to other gig platforms like TaskRabbit, Craigslist, SoundBetter. Our closest competitor is SoundBetter, who is purchased by Spotify. And they would be considered our closest competitors because they come close to attacking those voids in the market by addressing professionals, addressing the reviews feature, and addressing future needs scheduling. Our revenue model is unlike any other company that's currently available. We do not take a percentage from the professionals seeking opportunities. What this does is allows the professionals to negotiate their own rates. There are 3 subscription models. Basic, which is free, that's available for anyone in the market. Let's say you're having a party for your daughter and she's doing a Sweet 16 and you're looking for a local DJ. You can get on the app and find a local DJ. We have a service provider subscription, which are for the people seeking opportunities at $12.99 a month. And then we have a professional studio subscription, which are people who are creating the opportunity, that's for $30 a month. We see this being an excellent solution for A&Rs throughout the record industry. This is just a look at some of our app's features. You can see that when you're accredited through our app, once you're paying for a professional subscription, we validate your resume, and then you can have access to reviews. You can see the subscription plan and in-app messaging. So there's no phone number exchange. We don't take a percentage again from the job that you're creating for yourself. We're putting 2 parties in touch for a subscription. This is just a breakdown of what we are going to see ourselves building towards, which is a very powerful algorithm-driven app. But we're going to be slowly building our way towards the full scope of what we believe will be an app used by every record label in the music industry for their A&R purposes. This is our team: Mike Zombie, who I believe is on the call, Sean Dahl, our marketing officer, who I believe is on the call, and JB Marshall. Unfortunately, JB Marshall could not make the phone call today. He is a manager and former producer for Kanye West. He produced Kanye's first album, College Dropout, and he's currently promoting Genius, which is a documentary about Kanye on Netflix. So he's promoting that opportunity and couldn't make it this evening. I'll turn this over to Mike so that Mike can introduce himself a little bit and his pedigree, as well as speak to the app a little bit more.
Hello, everyone. My name is Mike Zombie, producer, artist, BET, award-winning, Grammy-nominated, multi-platinum producer, and this is my team, and we're so excited about this project that we've been working on for a short amount of time. That's been moving and flourishing, and thank you for taking your time out to listen. And I pretty much just want to give you a rundown of how I came up with this app. So I'm currently based in LA, and I always used to run into the situation of friends or colleagues asking, where can I find a producer? Where can I find an artist? Where can I find a DJ? To vocalist. And I just thought, like, a light went off in my head, and I was just thinking, wow, what if there was an app where you can go for a one-stop shop and people just make their own time and come and do what they do best, which is music, and they make their own rates and they can make their own time. And I figured during COVID, there wasn't a lot of people able to get work due to COVID. So I feel like this was a problem that needed to be fixed. And we came up with Wave, and we are worldwide. People have this app from London to South America to Canada to Russia. So yeah, that's pretty much my spiel, and the reason why I came up with this and connected with Sean Daw and Sebastian and now JB, who he said is promoting this Kanye Netflix extravaganza right now. So yeah, if you guys have any questions or anything, just let us know, and we'll enlighten you.
For some of you guys who don't know who I am, my name is Sebastian Jude. I am one of the co-founders and the former COO of a company called Create Music Group, which is got a unicorn status this year. Our claim to fame is we were able to design an algorithm that could identify 3 seconds of sound and claim that sound for copyright infringement across the internet and monetize that opportunity. So now we do copyright claiming for every major record label in the industry, have been behind artists like Tekashi 6ix9ine and Trippie Redd. And we continue to work with major copyright infringement assets and monetization throughout the industry. We just acquired Nirvana Digital in India, Mumbai based, which is the largest YouTube multi-channel network in India. I left shortly after our Series A to work closer with artists and to maintain my work within tech. Our projections on Ask or Next, we're doing things in 2 phases after our next investment round is closed. This is the next 12 months after the version 2 of our app is available. Our app is currently available on iOS and Android in beta form. We are going to switch over to an early access invite-only model so that we can invite some of our premier or A-list talent to the app and they can feel comfortable using this before anybody else. And then we'll slowly release that invite-only code through hyper-targeted digital marketing. So that first 6 months, it'll be strictly targeting the Los Angeles market. And then in phase 2, which starts in month 7, we'll allow the app to be available throughout the globe. Right now, we have had it in beta available to the world. And like Mike said, we have users right now in South America, Russia, the UK, and here in the US.
Perfect. Sebastian, I'm going to have to stop you there. We're at the minute mark.
On a great slide.
Perfect. Thank you guys for presenting. Just to understand, big picture, this is essentially connecting musical talent. It could be various different talents with the folks who are looking for it. That's it. That's what your app does.
That is the most immediate revenue opportunity through our subscription model. Big picture, Wave will be much, much larger than that.
Okay. So we'll put that off to the side. Let's talk about the main business. When did you guys launch the app? What was the traction? How many downloads in 2021, 2022? Give us some metrics.
So we started the company in January of last year. The app beta version that's currently available was available in March. Since then, we have around 300 users with nearly 100% retention currently on the app.
Okay. Geographically, are you guys limited to LA, California, or is it national, international?
It's currently available around the world.
Okay.
Yeah, we have users in Panama, we have users in the US, the UK, Russia. We have a few users in like Africa, and a couple of users in Southeast Asia.
This is the musical talent that's coming up.
Both musical talent and producers seeking musical talent.
Okay, so how many of those transactions have happened, and give ballpark geographic distribution of those transactions?
The majority of those transactions have been in the United States. It's only been around 24 or so transactions that have occurred within the app's ecosystem. We're not tracking data at that level yet. We do have a current promise to our users that we're going to track as little data as possible. With iOS's iOS 14 update, we had to really minimize the amount that we could do that. So this is mostly our network that are participants within the app and letting us know how that process has gone down. And then, of course, within our cross network, whether it's Mike, Shondal's, JB's, or mine, we're finding out through, following up with our customers who's actually, done any kind of cross promoting. And there has been at least about 24 instances of that.
Got it. So you're not actually processing the you're not processing payment through the app or anything like that?
Not yet. No.
Okay, perfect. Can you tell, right now, my guess is you only have the basic option available. Are the other subscription tiers open right now or not?
It's completely free.
Okay.
And it's they get to message each other freely without us collecting any information on that within the app.
Got it. Can you track how many active users are there today, this week, or anything like that?
Yeah, absolutely. Google Analytics gives us an idea of how many people are active within the app in any given week. We've been teetering around maintaining like 7% active of the 300 members. But again, like I said, we've had nearly 100% retention, meaning our members do come back and revisit the app somewhat occasionally to see who's on the map or see who's available.
Got it. Okay. Talk about your competition. I know there are a couple of other apps that are in the music industry that are trying to do something similar. Who do you see as your primary competition, and anyone else who might be close?
Sound Better, it would be our primary competition. And that's because of the fact that they were acquired by Spotify. Spotify is going to be putting a lot of money behind them. Spotify needs to renew their vision and their culture to seem like they're friendly towards artists, when in reality we know that they're not, and neither is Sound Better, right? Sound Better takes a very large percentage from the artists seeking the opportunity, which drives them or motivates them to up their costs. So normally when someone would only cost $50 an hour, they're putting their fees at $150 an hour just to absorb that 30% fee, which is normally what Sound Better starts when you first get on there, right? And then that turns off the end user, because they end up getting a quality artist that they expect is worth $150, but is not, right? So it's a turn off for both parties. In that regard, that is why we maintain the subscription model. We're not going to be charging a percentage. And in that regard, we have no competition. No one else does our model like this. The closest entities within the industry, the entertainment industry, that do things like ours is Actors Access, or LA County, which is the largest firm and company application that drives actors to auditions.
Okay, perfect. And your revenue, I'm looking at the slide you have on screen, revenue for 2022 ballpark, where do you expect to end the year?
It depends on version 2. We can't start collecting revenue until version 2 is live. If we are able to launch version 2 after we close a seed round, we expect revenue to be somewhere in the net ballpark of $8 million.
Okay, perfect. Thank you so much for coming on today. Really appreciate
Absolutely.
your time and your team. Obviously, thank you guys for joining us. Appreciate your presentation. Next steps, you'll probably hear from us in the next 24 hours or so. There are a couple of other questions, so it might be some questions that we need answers to, and it'll also have some guidance on where we go from here.
Sure,
But thank you for coming on and presenting today.
Thank you, gentlemen, very much.
Thank you
Appreciate
so
the
much.
time.
Bye, guys.
Thank you very much.
Right.
Thank you.
Thank you.
Yeah, I would request all the Fund 2 members to stay on the call.
Okay, it looks like they've dropped off. Okay, Shankar, over to you. Do you want to go through the companies quickly?
Yeah, I think I'll just open up generally. Any feedback on these companies, and I think Way was more. It now was more as I think they did some favor, some help for TiE SoCal Angels. We wanted to give them a shot because they don't have really revenue. So we said, okay, we'll look at it because they did help us with our website or something like that. So anyway. Just give me some feedback on some of these companies. What are the next steps? What do you like? What do you don't like? Let's do it quick. I think it's already 7 o'clock. Maybe in the next 5-10 minutes, let's wrap it up. Anybody?
Can I ask Zena to just take maybe 30 seconds and tell us about that device? She said she was testing it, so I'd love to hear her thoughts.
Can you guys hear me?
Yes.
Okay, great. Sorry, I'm not on video. I'm at my daughter's cheerleading class. So yes, for those of you who don't know me, I'm a posture and ergonomics specialist. So I was approached by this company to potentially become on board as a content provider eventually. If you compare it to I've used both the Upright Go and the Lumo Lift, which was a previous product that I'm not exactly sure what happened to it, but Upright Go is really the current leader. They're very similar in the way that they work. The Upright Go also has an adhesive. The Upright Go has a necklace, whereas the Strack only has the magnet in the back. I would say the UI on the Upright Go is better, but the Strack is really close to it. And I know they have plans to overhaul that. As in general, the product is very useful when I use it at my desk, and I recommend it to a lot of clients. I love the kinesthetic aspect of it. It really does buzz you and remind you to sit tall. It tracks your posture. And then what I think I like about the Strack more than Upright Go's vision is Strack has a plan down the line to really implement a break element to it, where it buzzes you to take breaks throughout your day, which is really truly the essence of posture and ergonomics in the future. More and more research is coming out that says that we should be taking these exercise breaks and posture breaks throughout the day. So that was why I enjoy the device and bought it to TiE for potential investment.
So Zena, how do you see people buying these products? Are chiropractors going to be prescribing those, or how does one get to know about this product and buy these?
Yeah, so
somebody has a back pain, they will look online and find this product. I'm just trying to figure out the market and go to market strategy.
Yeah, absolutely. So I think his various strategies in terms of physical therapy is one great avenue. Physical therapists talk to their clients often about posture and desk work. And in fact, I've talked to physical therapists about how much, in fact, I know for a fact there's about a 41% increase right now in neck and back pain as a result of the pandemic, people sitting at their desks for too long. So I think the physical therapy ortho rollout is a smart idea for them. And then the corporate wellness rollout. So companies, in fact, we did a partnership in December. My company did with Google. So I did presentations for Google. And so there was a couple Google teams who purchased the Upright Go for about 20 or 30 of their team members. And then we went over the product in the posture workshop, and then they utilized the product after the workshop. So posture is becoming more of a buzzword in the market in general. I mean, I can't tell you how many hits my website gets as a result of it. So it is growing. It has grown exponentially year over year. So I see it as a really good possible corporate wellness rollout.
Zina, I don't know if you know this, but Krish is asking if a chiropractor or a physical therapist recommends this device, is it reimbursable by insurance?
I don't know the answer to that question. Yeah, I don't think so at this point. It might be covered under HSA, as a product, but I would have to look into that.
Okay. Perfect.
It feels more like a Fitbit kind of product, so I don't think it would be probably reimbursable.
Yeah.
Okay.
Yeah, I mean, I don't know too much about the history of Upright Go and LumoLift, which is a product that was the very first product that came out about 10 years ago, or what happened to them. So I think it would be smart to look into the history of those companies and see that, check out the potential exit strategy.
Right.
Okay.
Deva, I raised my hand.
Yes, please.
Yeah, I asked the question about manufacturing. I think it's a positive thing that it's manufactured in India and not China, because a lot of these devices come out of China, and now with the strategy, anti-China, it's a good point. But my daughter uses, I think, Upright, and she's 31. A lot of people there at desks, they are on Instagram, these millennials, and they buy it. So they do, you could even think about an influencer strategy, but they're doing advertisement on social media, right?
That's Vijay here. I suspect this is just going to be a huge marketing play.
Yeah.
Price point is roughly the same. Anybody who has zillions of dollars to sell this will sell. Yeah. I don't think there's room for more than one or two players, and because it's a very narrow space. I don't know how they can extend the product beyond that. Something on legs or back, stuff like that too. But I think it's really a play for the well-funded companies. It's a direct-to-consumer play.
Yeah.
I think this company is going to struggle. I like the valuation and all that. I think the U.S. market is going to be tough for them to penetrate. And in his own words, the India market is.
Yeah.
By the way, I just searched Upright Go on Amazon, and the original Upright Go is available for $40, but they have tons of other devices that are, one is as large as like a computer mouse that you actually wear with a shoulder strap, almost like a holster, and it ends up in the same spot. And it's available for $13.99, $13.99. So there are going to be, again, there's going to be a wide range of offerings in this area, I think.
I have a question on the functionality wise. They said it's a magnet, right? It can stick to the cloth. But for measuring any of these postures, does it need to be sit on the or stick to the body? I don't know the technology behind it.
So both devices, the Upright Go and the Strack, have an adhesive that you put on your back that you can attach to your back, or you can do it the way that he uses a magnet up against your shirt in the back, or like I said, Upright Go has a necklace that you would wear and it hangs on your back. So it depends on what you're looking for.
Okay. Any thoughts on the other two companies?
The map company I like. I really like that map company. Again, I don't know how unique their product is, but it looks like they've identified a good market for that technology. Again, I don't know how unique it is, what it'll take for someone else to come in, but I think their team is good. Their product seems to fit a good need. I think there's scope there to look further.
My only concern there, and I'd love to hear Shankar's thought on this, that it seems to be a manual process of onboarding each building. He said 50,000 square feet takes about a week to import, and a lot of the process was manual. and he said that they are developing an automated process around it. Shankar, do you think that's realistic? You think they'll actually be able to achieve that?
No, actually, see, the problem with all mapping and facilities, somewhere it is manual, right? From manual,
Right.
it comes to automation. GIS is exactly the same thing. Yes, you do have some satellite imagery and all that, but you have to clean it up with hand. It's a lot of digitizing involved. And this is something similar because office buildings, floor plans, they're all in the system, but they could be some antiquated system, something different. It's an old system they use Intergraph. So it is very difficult. You do have to convert the maps. And definitely these guys are using some automation. Remember he was saying that 50% automation, 50% manual. So they're slowly improving the process, maybe some scanning and digitizing it, electronic digitizing. It'll take some time. And again, some of the elements, they don't need to map all the electrical outlets and all that. So it's a cumbersome process. And that's why big establishments eventually will automate, will require these on the systems. So it is, asset management in buildings is happening. It's becoming one of our SARA members is doing asset management and basically these assets, it is going to be important. I think Satish is the call. He's also doing some asset management. So these are all assets and eventually everything has to be automated. It will get there. It's just slower process, it'll get there. And there is manual work involved because you're taking all old systems, old buildings, old maps and converting it. And now there are other applications, places where you can use this map. If he is smart enough, we can sell it back to other people. Like the one I told you, hospital, airports, where they do internal direction.
They're generating revenue. I think onboarding is manual, but once the onboarding is done, it seems like it could be a cash cow, right? I mean, they're just charging by the user. So I think it's worth looking into more closely.
And it's pretty significant. It's almost $100 per user per month.
That's interesting, right? Once they digitize the maps, they carry their iPad or phone close to the device and then click on it. And then that positions that. It says, okay, it is this post on the map. So that is where the automation is beautiful, right? And then you can take a picture and put to it. So, okay, here is a not copying machine, some machine, refrigerator or cooler or something attached to this place in the map. So now he's providing them digitized map. They can use it for other things. Now his application also, it becomes automated now. And somebody can sit at a desk and boom, boom, go floor by floor and wing by wing and look at all the equipment in stuff for inventory control, for maintenance, a lot of things they can use it for.
Scalability is a big question. That's what we need to look into, I think. And also the problem is they're having trouble acquiring customers. So it's got one big customer, but nothing more. So it's I am interested in learning more about this company. I think it's worthwhile looking at, but can they really scale it and why are they struggling to acquire customers?
Yeah, customer acquisition, because the ROI is not immediately recognizable, it's going to be a slower process. They got to do a proof of concept. It's going to be a slower process and it's going to take some time. But once it's there, they won't leave. They're going to be stuck with it. So it's a stickiness is there, but acquisition is going to take some time. We can ask more questions, get more ideas from how, why, and all that stuff.
Yeah, as a standalone application, most of the big firms or the big building management, they try to integrate into their software. Okay, that's one of the challenges I see here. He also mentioned there is a pushback from their IT departments, right? Because there is no integration. So if they start integrating with the application, then there is a huge potential here.
No, any big companies, I've sold to so many big companies in my 30 years. It's always IT department will always come back with something. Right? Initially, it was client server. Why are you using this database? Oracle, I use Sybase. That's not a standard. And then later on, it became cloud. Oh, why are you using AWS? Now, what's the security? It's always going to be an issue when you bring in a system to a big company, a big entity. It's always very difficult to get in. IT will put it for, no, we can do it ourselves. We already have this, something like that. It always happens. The other thing, which I think I'd like to mention, probably when you do a deep dive, we'll do this. A similar company, one of our tech course angels has started a company called TrackPoint, which is to track non-attached devices. For example, in a hospital looking for a dialysis pump, where they put a tag to the device and track the device. And he is also going to go into that business, but he doesn't want to be in the hardware, like the tags and tracking. So whoever finds the best solution, they will integrate with them. This will go hand in hand because he's already got the map and digitized locations, the internal positioning system, they call it, instead of GPS is IPS, and now his tags will work with it. Neeraj also has something similar to tags when a patient and it is come through the hospital system. It's all, so this is all coming up together. The IoT, the tracking, IPS, it's all happening in businesses. That's the future.
Agreed. Yeah, there is a lot of potential.
Yeah, a lot of future. It's again, how do you realize the potential? What is your space? How are you going to get in? Who are you going to partner with? So there is going to be, especially in big companies, it's going to be a dance, and eventually it'll all happen.
Okay. So I think there is interest in that company. What did you guys think of Garako, the blood collection and sampling company?
So I've seen that company a couple of times now. So I think they have good technology, and this CEO, he just came on board there recently. He's actually kind of gave them much more direction. Biggest problem I have with them is their fundraising strategy doesn't really make a lot of sense. So they're raising enough money that lasts for 4 to 6 months. I've seen them last time in November at Cove Fund, and they were raising 1 million, and we were trying to ask them to take more, and I didn't want to take more. So I think it's a good technology. It probably won't have a lot of traction, but you need to understand if it is same round that TCA LA invested in at 7.5 million, it's probably worthwhile taking a look at. But we need to probe more into fundraising strategy, because he can't really, he's going to raise Series A simultaneously, and it's something doesn't make sense the way he's raising money.
No, that's right. He thought 1 million would be enough. I think he's burning fast, so he wanted 500K more. That's what is happening. Yeah, this is recommended by, this came through Kunjan. Also, he's an IIT guy. I think Kunjan had some contacts, and TCA is invested. I knew that, so it looked like a good company. That's why we brought it in. Yash has raised his hand. Yash, have any question? Okay. Anything else? It's been a pretty long night. If there's no questions, I think you will send me some emails on any input. I don't hear Venkat. Probably he's already gone.
Scott's, I think, trying to raise his hand.
Yeah, sorry, I just had one, since you were talking about InMaps. Their round is $1 million round at a $9 million pre. I think that they're, if you guys, it sounds like you guys might want to talk to them more, you should probably know they're at least half committed, maybe 2/3, with the round being led by MIT Angels out of Northern California. And I know he's in discussion with some other folks too. So if you're interested, sooner's probably better.
Yeah, and I think
it's a good sign, right? So.
Yeah, he doesn't want to oversubscribe too much. He will oversubscribe a little bit. So I think we will probably decide this week if you want to do a deep dive and they want to go in to ask our questions. I think we should move fast.
And I think Yash is trying to unmute. Yash, I think lower left-hand corner of your screen, you have to click on the unmute to talk.
A question for Scott. On IMAPS, is there any diligence material already there?
There is some, there's not formal due diligence per se, like we would do at Tech Coast Angels in terms of lots of paperwork, but he's been through a process, like I said, with MIT, and they did a couple due diligence sessions, and I know there are recordings of those, and of course he can do Q&A with you guys as well. I'm sure, I know I've seen that at least would be perhaps of use, but there's not a formal report that I'm aware of.
Because that itself might, then we don't have to keep asking the same questions over and over.
Totally, yeah. Well, yeah, you might want to. You could ask HD to, or I could ask him if you want to share the video.
I'll send an email to him tonight. Ask him to submit us more materials before our decision making. I'll send an email to him.
Okay, sure.
But what is their uniqueness? Is there any specific uniqueness in mapping?
For InMaps, It's a combination of things. It's hard to put your finger on, right? But it's the visualization is really what's different. There's lots of maps out there that are one-dimensional. These are multi-dimensional with the GPS plus the layers of different metadata that you can add onto it. It's kind of like, I mentioned this earlier, but it's kind of like, remember when we used to drive around with like Thomas guides in our hands, right? With a flat paper map? And now we have Google Maps with all these layers of things. It's kind of like that. So is it unique compared to other folks? Not potentially, but as far as we know right now, yes, nobody else is doing all that. And it's a complicated suite of things to put all those together.
Interesting. Just to add to Scott, this is exactly what I did. Thomas Brothers uses ESRI, and we did the same job. I did something for them, digitizing the maps to two-dimensional, and then added graphics and database to it. We created a three-dimensional data, but not the picture. And that this is the latest version of that.
Yeah, all the competitors seem to be very data-driven, which is fine, but missing the visual piece and adding the visual is, as you guys know, the picture's worth 1,000 words, right? And the multi-dimensional thing with all of that driven by a database that's searchable and reportable means you can start to instrument the whole building, you know. And if you look at the world of IoT coming, these guys have the pieces that pull a lot of other things together that at least I think is very interesting.
Hey, Anshuman or Ashish, can you look at Yash's comments? He's somehow getting blocked, and I don't see anything blocking him on my end.
There isn't anything. I mean, he should be able to unmute himself. There is.
I'm going to make him a co-host.
Okay.
Okay.
There.
Now, Yash, you should be able to speak and turn your video on and all that.
Oh.
Shankar, I have sent you a document to review and sign.
Yeah, I already did it. Yeah.
Okay, great. Thanks.
Oops. Yeah.
India just had its 9th unicorn this year.
Wow.
Pretty early in the year.
47 days, 9
days.
unicorns. 47 days, 9 unicorns.
So if there's nothing else, I think we should call it a day. It's a
long day today.
Okay. Thank you all for participating, and we'll definitely keep you all posted on what the next steps are. Thank you so much. We have a live meeting February 26th at the Cerritos Sheraton. Don't miss it. We're going to be announcing some new things and the new programs, and I think you should not miss it. It's going to be interesting, and dinner will be served, I think, right?
Yeah, we start at 5:30 with networking and dinner, and 6:45 the program starts with unveiling all the programs or committees, and then 7:30 onwards we have 3 fabulous speakers who are going to talk about blockchain, crypto, NFT, and Web 3.0/metaverse. So it's going to be a great night full of lot of information, I think. And our first in-person event, we are expecting almost 120 folks in there. So please do register if you haven't registered yet. And I'll be sent, the emails have been sent. I'll be posting those links again for registration. And yeah, please do reach out to me if you want to bring any guest who can be a potential charter member as well. And yeah, hope to see you all that night.
It's next Saturday. Don't miss it.
There you go. Next Saturday.
Thank you so much. Thank you.
Thank you. Bye-bye. Good night.
Good night.
Thanks, everybody.
Good evening. Bye.